The lying media breathlessly report rising death tolls from the sick coronavirus, as if COVID-19 were the beginning of an apocalypse. As of this writing, there have been only 26 deaths from the coronavirus in the United States, 19 of them occurring in the same senior living facility in Washington state, while the common flu has already claimed 17,000 lives throughout the country since the current U.S. flu season began last October. Moreover, as the CDC noted before, it too began contributing to the current hysteria. Influenza has resulted in between 9,045 million illnesses, between 140,000 to 810,000 hospitalizations, and between 12,000 to 61,000 deaths annually since 2010. And for the 2019 to 2020 flu season, the CDC had already predicted 34 million to 49 million flu illnesses, 16 million to 23 million flu medical visits, 350,000 to 620,000 flu hospitalizations, and 20,000 to 52,000 flu deaths in the United States. So, it appears that the number of potential U.S. deaths from COVID-19 will be a tiny drop in a large bucket of seasonal viral illness. That truth is buried deep in the middle paragraphs of the lying media's fake news reports festooned with hysteria-inducing headlines. For example, there is a fear-mongering Bloomberg News report, no coincidence there, with the terrifying headline, "There is a tipping point before coronavirus kills." One has to wade 5 paragraphs into the piece to learn that about 10 to 15% of mild to moderate patients progress to severe, and of those, 15 to 20% progress to critical. In other words, critical cases of COVID-19 amount to around 15% of 15%, or 2.25%. Assuming the death toll among that 2.25% is not 100%, the probable death toll from COVID-19 is far lower than that for critical cases of common influenza. As the CDC reported, during the 2018 to 2019 flu season, 900,000 people were hospitalized, and more than 80,000 people died from flu. That's a mortality rate just shy of 9% for critical cases of the flu requiring hospitalization, and the vast majority of those deaths are among the elderly. Also buried in the same article is the advice of Jeffrey K. Taubenberger, senior investigator for the National Institutes of Health, NIH, that the clinical picture suggests a pattern of disease that's not dissimilar to what we might see in influenza. Remember the swine flu pandemic of 2009 to 2010? It was caused by the H1N1 flu virus, which infected nearly 61 million people in the United States and caused 12,469 deaths and up to 575,400 deaths worldwide, according to the CDC. What about the rest of the world? According to the CDC and the prestigious British medical journal The Lancet, worldwide seasonal flu kills 291,000 to 646,000 people each year. That is, the greatest viral threat to human life on the planet, by many orders of magnitude, is and always has been the common flu, not any strain of coronavirus. By comparison, the more virulent but far less contagious coronaviruses causing MERS and SARS have claimed lives only in the hundreds worldwide, with very few or zero reported cases after the initial outbreaks in 2012 and 2003, respectively. Here too the lying media bury the truth. One has to scour the internet to find in the obscure journal Stat the telling comment by WHO Director General Tedros Adhanom Ghebreyesus that we don't even talk about containment for seasonal flu, it's just not possible. But it is possible for COVID-19. We don't do contact tracing for seasonal flu, but countries should do it for COVID-19 because it will prevent infections and save lives. Containment is possible. But why should the lives of individuals and nations be turned upside down to contain a virus far less lethal, or at least no more lethal, than a typical flu, which cannot be contained? There is no sensible answer other than the promotion of a panic narrative that clearly serves aims other than those of public health and safety. While the lying media consistently fail to mention the large death tolls from influenza nationally and worldwide, every year mounting right now, they are striving to provoke worldwide mass quarantines, travel restrictions, employee furloughs and event cancellations, based on 26 deaths thus far from COVID-19 in the United States, and 3,398 deaths worldwide, the majority of which are in mainland China, followed by South Korea, Iran and Italy. Compare this with the average of 646,000 deaths worldwide per year from influenza. In the end, what is really terrifying is not COVID-19, but rather the prospect that the demagogues might well succeed in exploiting it to achieve their end. The media is not about to let a good coronavirus go to waste.